So this is the case, not so easy. You know, I had some place here to put implants. This is after the extraction. You know, here the hole we have, big hole. So this, you see the implant here? So it was just placed in 3 millimeter like that. And really I was afraid, I was crazy. I was so excited to try it that I put it in really very hard condition. And after that, I put my biomaterial, look, red one. Okay, now you recognize membranes, suture. This is an ID can, this is the ID hole. It's placed here, you see here, to here. It was incredible, just like that, but good stabilization. And this is 4 months after. We have a nice ridge. I opened and I thought I've lost my ideal implant, maybe those, and the patient didn't take it. But I drilled a little bit the bone, and what I found, my ideal here, down.
Why you don't take X-ray?
Huh?
Why you don't take X-ray?
Yes, we can
The jury
take-
is there, just joke.
I did. It's a joke. It's a joke, but I took, sure. And I did a second step surgery to put some keratinized gingiva at the buccal part. This is the final case did by a colleague. We have everything good, no problem. So we continue. This is a patient with some implants here and very bad teeth, very big cysts, you know, you see? Everything is really bad. So I decided to take out everything. Look at the nerve, look at the infections. Impossible to work in one step. So we took out the implant, the teeth, bone graft. Okay, so after that, she had a removable prosthesis, okay, for 6 weeks. And after that, I did the guided bone regeneration everywhere. I closed. She had for 4 months a removable, so it's very hard time. But after that, you see how I put my implants, 4 here, 1 in the molar, first molar in each part. The provisory bridge the day after, transfixed one, okay, no cement, no cemented. This is, and now you see how where the bone is. Very nice bone, good level of bone, 15 millimeter here, 12, and maybe 10 here and here. This is the second step, okay, with the framework, with some final restoration, you see, and you remember from where we started, okay? This is a very nice girl. No, it's a girl, okay? There's no girl here. I can joke. Okay, so she was very depressive. Very, really, 35 years old.
Oh my God.
So the parents helped
Even
her to
the
pay.
dentist.
Okay, no.
The dentist will depressed, of course.
So I said to her, okay, I can do something. Maybe we put a full removable prosthesis on the upper jaw, and the lower jaw will do immediate loading. Wow, I did the scanner, and what I saw, no bone. Okay, so, okay, I'm sorry, miss, it's impossible to do in one step. We had to extract removable, graft, implants with immediate loading, and after the bridge. So, extraction, after we open and we do the regeneration. So, what I wanted to tell you is that when you put biomaterial above the cortical bone, the cortical bone grow very slowly. What the bone that grows quick, around 1 millimeter a month, is the bone, the trabecular bone. Okay, so always I do big holes in my cortical bone to let the vessels come from
Yeah.
the clavicular bone to help, because like that, I know that I can tell to my patient, I know I need 4 millimeter bone, new bone. I say, okay, I can see you for the second step in 4 months. In the sinus, I see the first wall, the second wall. I just measure the distance between the two walls, and I know that every month, 1 millimeter we grow. So I can schedule at 1 month around, but I can schedule that in 4 months or 5 months or 6 months. I can go to the second step. You know, like that, you can know that 1 millimeter, but not from the cortical bone, from the trabecular bone. So, bone graft, you see everything is red everywhere, membrane, sutures. So, we arrive to have this thickness of bone. It's not very, very good, but you remember from where we started. So, for those cases, the day of the implant placement, I add another part, another layer of biomaterial and membrane, and I close. Like that, I have what I want. So, we started here, we have this result, so we can put implant. Look, the provisory was, the picture is after 3 or 4 months, so it's not nice, but the panoramic is very nice, everything is good. And we took the impression, we did the final restoration transfixed. I like the transfixed one. You know, I have patients from different countries, from different cities in France. And when I did the ceramic restoration, when you have one problem, if it's cemented, you can take a gun and finish your day, because you have to cut everything, it's the war. So you can forget it. And when a ceramic is in the mouth for more than 3 months, it's impossible to have a new soldering of a new ceramic if you have something that breaks, and so many problems. I don't like problems. So I explain to the patient that with the resin, if they have the problem they have, I can deal that in my office, or if they are not in France, they are in vacation, they can go to a dentist, it takes some resin, he glue that, and after I can see. They have their provisory that can help them, so I can take out the tooth. If they have any problem of bruxism, or I don't know where, a few years after, because sometimes you do work and 2 years after it starts a bruxism, because nervous, because a lot of things. So all your teeth will be plates like that, so you have to change them. It's easy for a small price. We can change all the teeth. You stop, please. Okay. You can change all the teeth. It's easy for the patient. Really, think about that. It's easy. Acrylic. There's good qualities now for acrylic teeth. No. No, you have a bar. You have fixed bar and the acrylic on, and it's screw on the implant. It's not removable. It's not removable. It's a bar, the full arch, metallic, and with the resin on. It's not removable. No.
A screw.
When you unscrew, you take out everything. You understand?
And acrylic removal or no?
No removable.
As a permanent. Instead of ceramic.
Look,
Yeah,
this bar, you put on this bar those acrylic teeth, and you just let the holes to screw the whole thing.
هي فيتاليوم مثبت
Essaie de lui expliquer que c'est un...
فيتاليوم مثبت على الزرع.
ايه
بعملوا قاعدة بتعمل الفيتاليوم مثل ما هو وتثبت من خلاله على الزرع.
بيعملوا الكريل على الفيتاليوم.
تماما.
يا رب تحت الطعام
بس الأكريل
طبعا لا يستعمل فراشة صغيرة بين الأسنان بدها عناية كثير فيها. Alors, soit du bon hygiène, c'est ce qu'il dit. Comment il arrive à nettoyer, je dis des procès, il y a du water.
you will think I'm crazy. I can tell you, each time I've let in the past place between implants and the gum,
On the go.
people speaks and it goes boom boom. It's a gun for people in front of them, and it's never so clean that we think. So, in my opinion, I put just the resin in the same level of the gum. No place to clean it. No, they just brush it, and once a year I unscrew, I see, because I was afraid of my decision to do that. So once a year I tell them to come, and I unscrew that. I can tell you, some people, there are some small part, so you just have to take another impression, just to tell to the laboratory to add some resin, nice. And some people, it's very nice, it's very clean, no problem. I don't have a lot of problem, but it's my decision. I respect other people that they do differently than me, but in my experience, I don't see so many problems. So, and each time I let them a lot, it's a discomfort for them, they don't like. They like that. I have to clean that once a year. For the moment, it's not a problem.
In such cases also we can use the buccal flange, but from lingual you can make it short to easy the patient to clean it from lingual side, and if the patient doesn't want, you can shift also the hygiene and you can clean very simple. Don't make it sad like that, to close from the both side. You can close it from outside and from the lingual side short.
Yeah. So, this is a removable prosthesis. This is the screwed full arch, you know, from where we started. Okay? So, what we see also is that all around the threads of the implants, even if you put it in guided bone regeneration, you have always new bone around the threads, and you have never a contact between, this is a biomaterial, you will have never contact between a biomaterial and an implant. Why? Because when you drill inside a bone where you have some bio-os and a new bone, you will have some blood all around the threads of the implant, and this blood will be a new bone. So you will always have new bone around the thread and never a contact between a grain of biomaterial and the implant. This is a case for, we had to extract this tooth, you know, we have some resorption of the root. Okay, extraction, implant placement, regeneration, membrane, and I did in the same step, the provisory crown, and I took the gun just here. This is the implant, this is the healing after a few weeks. This is the step of the final restoration. You see that your provisory did a good job, a good work. Acrylic, yes. And this is the ceramic single crown that you have. This is a nice story of a big problem. It's a patient, special patient. It's not really decay, but some demineralization. Not, comment on dit, c'est pas du tartre, it's not tartre. Calcul. So he didn't want us to touch those teeth. He just asked to change because this one was broken and to change this one. So, and I don't know why, but he liked those teeth. So we had bone, no problem. So here post-extraction implant, here implant. We put 2 provisory crowns the day of the surgery, okay? And this is the implant placement in the bone, in the control. and I let the patient for 4 months. 4 months after, he came. It was very nice, very, very nice. I did a CT scan, and what was my surprise to see this big infection. Here, you see,
Yeah.
infection, damaged all the buccal bone here for this implant, and this not the implant with the post-extraction one. It's the implant where the site was healed. I didn't understand why. So, what I
15 or 15% or 12?
yes, 15. So what I did, I cut here the gum because the aesthetic results was very nice. I didn't want to, but I was crazy about this case. So I wanted to try something. I just cut the head of the implant here. Okay, all the apical part, I cut it.
How you cut?
I cleaned it with the laser,
How you cut it this time?
with a metallic burr, you know.
Yes, because you too much chips and powder of titanium will leave it in the tissue.
Yes, I can tell you yes for everything, man. But it was,
Sometimes
I tried something. I can tell you, you know, here I don't show you just the very nice cases. No. I show you the reality of my life, and this you will have maybe something like that. So I found a solution, and I can tell you, okay for everything you say.
this patient.
Okay for everything you say, but when you have that, you try something, because after that
But
you
it's better to put new.
But it's difficult for the patient to remove it in this time because he like his teeth and they come to
It's
I
nice.
have to
The
do
gingiva,
something. Don't touch
look
this
at
one.
the gingiva,
Because
the
it-
papilla.
Yeah.
You never
Yeah.
have.
And this
with
patient
two
said,
implants,
"Don't touch
very
this."
Nice
How we
papilla,
can-
I like that. So I was crazy. I wanted to keep these results. So this is the bone graft, okay, up to the implant, and this is the final crown, as bad as
The same, there to the bone.
but you look, it's nice on the
Like
gingiva part, and you see it's special like that. Okay, and I can tell you that it's more than 1 year and a half, and it works for the moment well. If there's a catastrophe, I can tell you. I will tell you next year. Okay, I have a few minutes to speak about, because you wanted me to speak about PRF and okay. So I will show you a new technique. You heard about PRF? No? Nobody heard about PRF? Okay, it's platelet-rich fibrin. I spoke to you about. I would like just you to listen.
Wait.
Yes, not to speak too much, because
Wait,
it's difficult for me to be still concentrated.
يا دكتور اسمع الحته دي حلوه.
اسمع يا ولدي.
اسمع يا
Alors, okay, so I spoke to you about the bone morphogenetic proteins, okay, that can give you new bone without bone around. The growth factors are some part of the blood that can enhance and accelerate a healing, okay, of the bone or of all the tissue of the body. But it can't give you bone if there is not bone around. The bone morphogenetic protein, if it's like you come in a room like that, empty, you put bone morphogenetic protein and you say to it, clean the room, and it will be cleaned. You don't understand why and how. The growth factors, it's like you are growth factors. I can tell you, please help me to clean the room, and we work. But we need to be here. We need to have all the cells all around, bone and everything. So that are the growth factors can do something if they have the environment of bone all around, or skin, or what you want. If you have any problem, my mother had a problem of diabetes in the toe. I put it PRF on, and it healed very, very quickly. So it works when you have some blood vessels that arrive, everything, but it accelerates the healing. Okay, that is, and what we do, we take some blood sample from the arm, we put it in a vacuum, and we rotate it in a centrifuge for a few minutes. The protocol, you can have it. And after that, you have here the blood cells, and here you have the plasma with the growth factors inside. And in the PRF technique, there is something in the tube here, okay? That name is silice. You know silice? Silicium. Comment on peut dire le sel?
Non, c'est pas
Silicium. Okay. It's small grains, special, that are in the tube. And when you finish the rotation, you take like a gel that is fibril with growth factors inside. You just have to cut with a scissor here, and you can use it. You can cut in a small part. You can mix it with biomaterial. You can put it under the gun before closing. It helps you to accelerate something, but don't think it can give bone. Okay, alone, no, never bone. Just you have to accelerate the healing. In this technique, I will show you the MPM, mineralized plasma matrix. You have the nothing inside the vacuole, inside the tube, and when you do the centrifugation, this is liquid, not gel. So you take a sample, centrifugation, you put some saline here solution inside the cup. You can put some bone recovered from the site where you work. You put inside, and when the and you put the biomaterial here. That is the first preparation. When the rotation is finished, you take with a needle, okay, you suck the liquid where you have the rich factors, and you see? And after that, there is some growth factors, we know them. You put it on the biomaterial, in the cup of the biomaterial. And now, you take a probe here, okay? So that you can just stir and mix and mix. It takes maybe 5 long minutes, and you will have the fibrinogen that will become fibrin, but you are mixing everything, the biomaterial, the fibrin, and the growth factor. So at the end, you have like that a past, you know, mixed of everything. It's very nice. So you can cut it, you can form it, you can shape it, and you can put it in different cases. So you work in the conception of guided bone regeneration, but you help with some cells inside. Look at this case. Here I had the place to put an implant here, and all in the front, but not placed here in the right side. So here you see not a lot of bone at the right side. So I put my implant, as I said, you know, the idea of the small pieces to put my implant in good conditions, screws in the right place. I put my biomaterial here, TCP, with the growth factors, with the fibrin, you know, how it's red now, always. I closed here, I took the impression, the provisory the day after, you know, it's short here at the right side, but it goes to the molar here, you see? And here we have tried, it was, I say to my patient, you don't pay for the right side. I try something, if it works, it will be good for you. So this is the first biomaterial, and the day before. This is the screw that helps me to maintain the biomaterial. This is the result we had. So always you have to think about some resorption of everything. But here we started with that, you know, this is the biomaterial. And at the end, we have some resorption, but look, it's good. It's 3 millimeter bone, that. It's not nothing. It looks like something bad, but 3 millimeter is 3 millimeter. You can, where you have 7, you go to 7 to 10, you put an implant to 10. So, where we started, where we finished. Look, we see here. I was able to put an implant, and now I am waiting, and I will tell you maybe one day if it works. This is another case. Young girl, 35 years, the same case. You see here? No.
There's nothing.
What to do? Look. Okay, so we start. First, guided bone regeneration with the same technique. Membranes, suture, removable prosthesis, and wait for 4 months. What I didn't think so well is that a so thin part of bone can't give me 1 millimeter a month. Remember what I said? I was too, too ambitious for that. So this is the CT scan after the graft. You see the holes I do in the bone? Chack, chack, I push. And this is the day after the surgery. This is 4 months after. So, I have bone, but I don't have very nice ridge, but it's really better than in the beginning. So I was able to put implant, but it was really very difficult here. I didn't have a lot of bone. And in this place, I broke a part of the bone that I regenerated. But they were all well stabilized. So what I did, I said to the patient, Miss, listen to me, impossible to put a bridge tomorrow. We will wait for 4 months.
This one after 8 months?
So this is after 4 months.
4.
So now, at this step,
We'll add again.
I just took this part of bone that broke to do analysis, okay, histology, and I put my biomaterial, my membranes on it, and we wait for 4 months more. Understand? I want, because she's young, she paid a lot for that, I want for her something good. Okay, so I close, I take a long time to close everything well, clean. This is the sample we took. This is, now you recognize, here it's allogenic bone with no osteocyte here, and this is the new bone all around with a lot of osteocytes around. So now you are very hot for the histology. Okay, this is, now I put the provisory bridge on this patient. She's very nice, very, very, very nice here. And now she's able to go. We wait to do some nice gingiva, to work about some new kind of papilla, and after she will go to the dentist to do a nice bridge to finish that. That's a nice story.
Doctor?
This is the implant.
Doctor,
Yes.
in the first step you put bone, but it's hard to have more gingival to close it.
No, in this case, I didn't add a lot at the second step. I just add maybe 2 millimeters thickness, more up to the implant. So you just have to cut some fibers and you close. And
No,
the day-
the first time.
The first time I took I took the maximum. I cut everything to close. When you need, you need. When you need, you need. Look at the case. It was an incredible case for me also. Maybe after we'll finish, I can speak for all the day. This case arrived like, okay, it was a very exigent patient. She wants very nice final work. Wow, how to do? Here the gum was very up, here low. It was not homogène. How would they balanced? Homogeneous. Je me démerde en fait. Alors, Frédéric, j'y arrive?
Oui.
Merci. Je vais faire bosser un peu comme peut-être, non? La dernière minute pour le fun. So, I put 3 implants here with the MPM and biomaterial, like you see. And we've closed, we wait. After I open the gum, I put provisory. I don't let you, I don't tell
Yeah.
you all the story, but I do step by step because impossible to do. I did a lot of surgery to homogenize all the gum here. I put some provisory crown here and here to have some. That was the day, so I've changed all the crown here. You see, it's new crowns.
Yes.
And I just had to put my 3 implant crowns. This is the day I finished. Okay, I was happy. Okay, there is some blood, but we know the day of the implant, the crown placement. It's like that. Okay, I was happy. She said to me, doctor, I feel something. During all the month I did this case, she said to me for the 21, doctor, I feel something in this tooth, but I don't know what. I did radio, I did everything. I never saw something, so I said to her, I don't know what there is in this tooth, but we'll see. Doctor, it's not very, this crown is not very pushed nice, so can you take it out? Okay, I said, wow, I had to do that quick. I took my arrache couronne, crown, okay, removable. I removed the crown, and it was the final day, I can tell you. Now, I broke the crown. Like that. The crown was broken inside, but I never saw it. So when I wanted just to take out the crown, la fêlure, becomes something that broke. So we went to the CT scan. The quoi?
Crack.
The crack. Okay. The crack becomes a real fracture, and we comes the hour to the CT scan, to my surgery block, and I have lucky to have some bone up to the crown. I've put implant, provisory crown. This is the 2 hours after. I was crazy, I can tell you. I was crazy. Everything was finished. I was crazy. And this is the final restoration of all the crowns. This is the beginning of the case. You can be happy of this result. Okay. Well, I think I will finish because we have the diploma. Maybe I can see you maybe another time because I have so many things to show you and to speak with you. But I thank you. I thank you for. You are very nice.